Hello people, in this video let us look at the symptoms of respiratory system. So when a person comes to you, what complaints will he bring? So he can say I have cough, right? Basically what is affected, either his upper respiratory tract or the lower respiratory tract is affected. So he can have cough which could be dry, productive, etc. Sputum, basically the expectoration, how will it be? You'll have to explain that. Hemoptysis, if the expectoration has blood, right? That is hemoptysis. Then the person can have wheezing. He can complain of wheezing, or they can complain even of chest pain, and they can complain of breathlessness. That is dyspnea, right? Or they can be doing fast breathing if they say that. Okay, that will be tachypnea. So yes, the intention of this video is what? To look at the signs and symptoms, isn't it, guys? Sorry, to look at only the symptoms. Is that cough? So basically what is it? It is a reflex act. There are, how is the mechanism of cough? Basically, contraction of the respiratory muscles against a closed glottis, okay? So basically it will try to clear the airway, right? That is what its intention is. So the types of cough you should know, guys. There is dry cough, there is productive cough, there is short cough, brassy cough, bovine cough, prolonged and paroxysmal cough, barking cough, hysterical nervous individual, barking cough, and there is epiglottical involvement, okay? There is nocturnal cough, etc. Coming to sputum, guys, basically the sputum normal, there's a normal amount, but if it is greater than 100 ml per day, it is bronchorrhea, you can say. So basically what and all it contains, you can know, and when it is produced, okay? Then let us see the chronology, which comes first. Basically, if the sputum is more in the morning, for many years, it could be chronic bronchitis, okay? The color of the sputum also is important, can be green or yellow, indicating what? Bacterial infections. This is very common that we see, isn't it? And then it can be black because of coal workers, then it can be rusty, red currant, jelly, sputum like Klebsiella pneumonia, etc. It could be blood-stained in tuberculosis, it could be anchovy sauce sputum in ruptured amoebic liver abscess, if the liver abscess is ruptured, okay? The consistency of this sputum also matters. It could be serous, mucoid, mucopurulent, etc. The odor of the sputum also matters. It could be offensive in lung abscess, etc. Coming to hemoptysis, that means the expectoration has blood, right? There can be frank hemoptysis where there is blood only. That's what they are saying. Hemoptysis in suppurative lung disease, spurious hemoptysis, pseudo-hemoptysis. This is because of what gram-negative organism they are saying. Endemic hemoptysis can be there. Fluke, because of fluke, that lung fluke, okay. Paragonymous Westermann, all the fluke, that is the trematode, isn't it? Fluke means. Severity of hemoptysis, they have told you. So you must understand that there is grading. Massive is also there, not just mild, moderate, severe. There's a massive also in this. The causes of hemoptysis, remember tuberculosis important. Then, what is hemoptysis, hematemesis difference? Basically, hemoptysis is sputum with expectoration with blood, and hematemesis is the vomit with blood. Another thing the patient can complain about is the dyspnea, that is difficulty in breathing, or undue awareness in the respiratory effort, right? So there can be an increased effort. So they could be using their accessory muscles, etc. There's a grading of dyspnea, basically if they are exerting themselves, if there is breathlessness on exertion, etc. You should know the classification. Then what are the receptor mechanisms involved in dyspnea, something like that. Okay. These people can also complain about chest pain, guys. So they can have pleural pain, etc. So these are the symptoms of respiratory system.